The holidays officially beginning tomorrow and then heading up toward Christmas and New Year's. Lots of people will be gathering together. That's a potential breeding ground for the spread of infections. Our medical expert, Dr. David Winter from Baylor Scott White Health, joins us with his thoughts on this and on the things we can all do to help minimize that exposure. Good morning, Dr. Winter.
Good morning. Good to see you.
Look, first of all, I want to say, what's really going on with those infections, and are you seeing a lot of folks with it?
Yeah, in my office and my partner's offices, we're being besieged with phone calls and office visits with lots of folks with respiratory infections, sore throat, runny nose, headaches, fever. We're seeing a lot of influenza just starting to take off. In fact, nationwide, we're seeing more cases this time of year than we have in recent years, in the last 5 to 10 years. A lot of influenza going on right now. In fact, they're saying 500 deaths in America so far. A lot of other viruses out there also, and so as people travel, intermingle, as you said, we're likely to see a lot more spread of these viral illnesses.
And we know that we have vaccines available for most of them, COVID, flu, RSV. Are the vaccines doing their jobs?
They work well to prevent serious infection if you take one. Unfortunately, right now, only about a third of all adults have had a flu shot, and less than that 14% have had a recent COVID vaccine. So the vaccines do work, but you have to get one in your arm first.
Yeah, a note that everyone should take around here. Besides encouraging those vaccines, what are you telling your patients? How about the ones who have recently become sick?
Yeah, the best advice I can give, if you think you have something or you have some illness right now, stay home. It's interesting because viruses cannot survive unless you go from one person to the next. They divide inside other cells. Now, bacteria, fungal organisms, they can survive on plants, on surfaces, other animals, but viruses, no. Maybe 30 minutes on a cold surface, then they're dead. So the best way to treat your family and treat your friends well, don't go out if you're sick.
Okay, so if you know you're sick, stay at home this Thanksgiving, okay? In addition to staying away from others, what do you recommend for treatment when patients call?
Yeah, the symptomatic medications over the counter, they do work well for cough, for fever, for aches and pains. Those things work well. Also, a hot tub or a hot bath really works well. The infectious disease doctors tell us that we have fever because we tolerate it better than the bugs do. So raising your body temperature works well. If you do this for a long period of time, be sure and drink lots of water so you don't get dehydrated when you get out. That works well. And as far as specific medications, that depends on a diagnosis. The medication is different from COVID. It's for RSV, for influenza. And the federal government just announced they've got some more free testing kits for COVID if you go online to covidtest.gov. I did this yesterday myself. Easy to do it. All they need is your name and your address, and they mail them out to you. Good to have those on hand when you start to develop symptoms.
Yeah, and I even heard if you didn't get your test last time around, you can get those plus the additional ones that they're giving out this time. So always good information there. Dr. David Winter, always happy to speak with you. And happy Thanksgiving, since I won't hear from you again this week at least.
Happy Thanksgiving to you.
Thank you.